Well, good morning. My name is Dr. James Stillerman. I'm the medical director at the Advanced Wound Care Center for Samaritan Medical Center. We're located on Coleman Avenue, right off of Arsenal Street. I'm a general surgeon by trade, and the natural progression would be to concentrate completely on wounds. As there was not a center here before, I thought this would be a perfect location and opportunity to introduce this treatment modality. A wound care center will be taking care of wounds, and we concentrate on that. Patients that have chronic wounds are referred to our center. We like to say we treat the whole patient, not just the hole in the patient. Now, what I mean by that is we treat the wound itself, but there's a reason why this is still staying open past 4 weeks. So a hyperbaric chamber is used for very specific wounds. It's not our first-line treatment. It usually comes in after the patient has been treated at our clinic for probably a period of 4 weeks or more. And if the wound is not improving with what we're doing, and we have corrected all of the potential problems that are keeping this wound open, this is an adjunct or an additional treatment modality, and that's when we would consider that. It's not for every patient. Jeff is a neuropathic diabetic. That means he doesn't have good sensation in his feet. He has a wound, so we go through essential steps to find out what may be the cause, and one of these in his situation is trauma. So we're going to do something called total contact casting. The wound is on the heel. It's already been debrided. Katie is putting on some padding so that when we put the cast on, his foot is protected. The purpose of the total contact cast is to offload or remove pressure on the bottom of his foot, which is where his wound exists. So diabetics have multiple issues, and some of it is circulation, some of it is high sugars in their blood, some of it is trauma to their feet because they don't feel and they walk repetitively on a certain portion. So with a period of time, the foot gets deformed, the bones start to change in position, and there are pressure points. So the casting is a way of relieving the pressure to allow the wound to heal. We get a lot of referrals from the patient's family physicians. I also do telemedicine, which is a nice aspect. So these are patients that are in our hospital. We get their consent, and then we do a telemedicine consult so that the patient does not have to come to the wound center. I can pick this up on our computer and do all the things that we would do here except debridement, and we would start the ball rolling in their treatment, and then when the patient improves and is discharged, they will follow up here. And then we have patients that are basically self-referral. In other words, they may have had a family member that had been here, a friend, and are just saying, you know, this is just not getting better. My friend was there, and maybe I should consider this, and they will call up. So it comes in a lot of different ways, and we're open to all of them. If you think you have a wound that is not being treated appropriately or is chronic and you need another opinion, please ask your physician to get a referral, and we'd be glad to see you, or you can actually call us direct. We're open 5 days a week. We'd be glad to take care of you and at least evaluate the problem and get the appropriate treatments underway.